Peripheral arterial disease is a narrowing of the peripheral arteries that carry blood away from the heart to other parts of the body. The most common type is lower extremity PAD, in which blood flow is reduced to the legs and feet. Dr. Jacobs tells us how they treat this debilitating disease.
Well, PAD is the most frequent form of vascular disease that people present to us with. And what it causes is early on symptoms where you run out of gas. The oxygen in the muscle is not getting replenished fast enough because of the blocked arteries not getting flow there. And so patients that walk away start having pain in their calf or their lower leg, and they have to rest a minute and let it catch up and clear out lactic acid, and then the muscle feels better. When it gets worse, then PAD can cause injury to the point where there's non-healing of a wound or a toe or infections that occur, and it's really a limb-threatening problem. And the treatment of that is to restore that flow. The first thought is to get imaging. We do that with ultrasound, typically non-invasive, which we can do here in the clinic. And then we can do the diagnostic angio, where there's a catheter placed in the arteries, and then we shoot dye with the catheter and treat it usually at that same setting, if that's something that we could treat with a balloon or a wire, and that kind of technique of endovascular rather than open. The results are really good. It's partly because of the minimally invasive nature. The initial results are great, but the avoidance of a long incision or taking vein out of one leg and using it to bypass the other, something like that, means that overall the outcomes are better with endo for the patient overall.
I now have circulation in my left leg. I have pulses where I never had them before, and I can walk further than I could before without getting cramping. I've had many, many surgeries. This is the first time a surgeon waited after I was out of the recovery room and kept coming in and checking on me for an hour well into the evening to see how I was doing. To me, that's unheard of, and speaks to the compassion and the ethics that Dr. Jacobs has.
The vascular surgeons at CU Medicine Vascular Surgery offer the full range of treatment options, from lifestyle modifications and medications to the latest minimally invasive procedures and complex open surgeries, making them uniquely positioned to provide the most appropriate treatment for their patients.